Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Dr. Shakira Henderson, who is the Dean, Chief Administrative Officer, and Associate Vice President for Nursing Education, Practice, and Research at the University of Florida College of Nursing, and the System Chief Nurse Executive of UF Health, about her career and her thoughts about trends in the nursing industry. So, hi, Dr. Henderson, how are you?
I am great. Thank you so much, G, for having me. I'm really excited to be here.
Of course. Thank you for taking the time. And let's jump right in. How did you begin your journey into nursing?
So I have to say, I have to start off by saying, and this is probably not good. I didn't start off wanting to be a nurse. I
Yeah.
actually started off in the science field. I was a lab technician and working on my research in the lab. And I one day was walking through the lab. I used to have to go to the lab at 5 a.m. in the morning.
Hmm.
And I used to go through the College of Nursing door. And I looked up and I saw nurse researcher, and I thought, oh my goodness, I could actually be a researcher that talks to people instead of cells. I had no idea I could be a nurse researcher. So,
Hmm.
long story short, I actually ended up doing my accelerated BSN while I was doing my two masters and pursuing research, and started off my career very non traditional as a neonatal nurse. So, my
Hmm.
nursing prescription of choice is neonatal nursing. So, that's how my journey started and loving it ever since.
Absolutely. That's fascinating. So, who have been some of your biggest influences in the industry?
I know this is, very, very cliche to
Hmm.
say, but I would definitely say Florence Nightingale. Very cliche to say, but she is the quintessential nurse. She was not just a nurse, but also a nurse researcher as well. And so I love the idea that she combines the art and the science, which is very
Hmm.
much my style. I think nursing is an art, but it's also a science. It's an art of caring, and it's a science of how we care for people, and we implement evidence based practice. So for me, I always go back to Florence Nightingale. And I know that's cliche, but
Hmm.
that was one of the biggest influencers in my nursing career. What would Florence Nightingale do?
Absolutely. Yeah. I love that idea of nursing as the art of how we care for people and the science of how we do it. I love that. That should be on a t-shirt somewhere.
I know I should probably make it.
Yeah, you should patent it. Yeah. So, what was your best mistake and what did you learn from it?
I would say my best mistake came when I first started in nursing leadership. And this may sound very familiar to new leaders and even seasoned leaders, because I think sometimes mistakes can happen across the board. It doesn't really matter where you are in your career.
Mhm.
I was charged with leading an initiative, and I will be very honest. I actually thought, at the time, I thought people could actually read my mind. And so
Mhm.
I thought that everybody understood the mission and the vision of the initiative. And I probably said it once or twice in a couple meetings. And then I moved forward with the initiative. And the initiative was system wide. I had
Mhm.
to have at least maybe 100 different nursing leaders on board. And I thought, if I told them once or twice, they would get it. And they
Mhm.
absolutely understand. And they are mind readers. They can certainly understand what I'm doing. And I would definitely say it failed. It
Mhm.
was not able to get off the ground. And we absolutely missed the mark on the initiative that we were trying to put forward. And I will tell you what I learned from that is that you can never over communicate vision. And that is my
Absolutely.
biggest lesson. And so the teams who work with me now and who've worked with me in the past know that I put mission and vision on every single agenda. I start every meeting with mission and vision. I talk about mission and vision in town halls and meetings, because you can never over communicate mission and vision. No one are mind readers. So that's my biggest mistake, and I've learned quite a bit from it.
Absolutely. Yeah. I mean, I'm a journalist, so I understand the importance of constant communication. It's truly key. Um, so what do you think are some of the biggest challenges currently facing CNOs and CNEs and other nurse leaders?
Well, there are many challenges, but I'll concentrate on just a few. The first one, top of mind, the
Mhm.
nursing shortage. We know
Mhm.
that we have staffing issues, retention and turnover, and the staffing issues is a big issue. We're facing the largest nursing shortage that our generation of nurses have ever seen. And so
Mhm.
we know that that is going to be one of the biggest challenges that C suite, nurses in any type of leadership organization is facing. The other big challenge that I don't think is as forefront as it should be is this new technology integration. We are
Mm.
really facing an era where we're challenged to integrate technology and innovation faster than we ever have. And so
Mhm.
we have to think about how do we do that in a way that is not further burdening our nurses who are already burdened. And talking about burden, I think we're also facing a time that I have never experienced in my nursing career where nurses are burnt out.
Mhm.
And so, figuring out how do we burn bright instead of burn out is one
Mhm.
of the biggest challenges I think that we're facing. So I'll stick to those top three because they are just top of mind for us.
Absolutely. And speaking of the workforce shortage, what are your thoughts on strategies for recruiting and retention to kind of address that issue?
Interestingly enough, I am a fairly new, I would say, new nurse leader in this realm. I've been around for quite some time,
Mhm.
but very new in the realm of system nursing. I've done other system positions outside of nursing, and I've had the ability to be able to work with system CNEs, but this is my very first system CNE role. And I'll
Mhm.
tell you, I think that we have to start thinking out of the box when it comes to strategies that can help with recruiting and retention.
Mhm.
One of the things a story I always share is that when I was a bedside nurse, we would have a lot of beeping. The beep, beep, beep would be
Mhm.
constant. And I heard that beeping when I was off the bedside for 2 years.
Oh,
I would
wow.
hear that beeping.
Mhm.
Still hear it just before I go to sleep because I was a night shift nurse. And when I think about strategies, I think that we have to think about that trauma and that impact that bedside nurses are experiencing and think about potentially nursing sabbaticals so that people
Mhm.
can recover from the trauma. The other thing
Mhm.
I want to share is that nurses see death and loss and grief and really traumatic experiences at the bedside. And we expect them to just recover and come to their shift the next day and be okay. And we would
Mhm.
never ask another human being to see something so traumatic and recover within 24 hours or even less than 24 hours, 12 hours if they're
Mhm.
working back to back shifts. So I think our retention and recruitment strategies need to focus on how do we improve the way we have well-being and workforce balance for our nurses. We have to think of more innovative ways to be able to recruit nurses to the profession because I'll tell you, we're having a hard time doing that right now
Mhm.
because folks don't want to work 12-hour shifts. So, flexible scheduling is another opportunity. How can we have what we used to say back in the day, mommy schedules? So,
Mhm.
people can have the ability to spend time with their family, see their child's soccer game. When you work 12-hour shifts, you miss. When you work weekends and mandatory holidays, we miss. I think sometimes we don't think of the nurse as a human being. And we have to
Mm.
rethink that
Mhm.
because nurses have families too. They just sacrifice them to take care of ours.
Absolutely, yeah, and all of that kind of goes to the burnout point that you were making earlier. And so I want to ask, how do you think health systems, or what do you think they can do to increase overall nurse well-being and promote better work-life balance?
I think one of the things that I know all health systems are working on now, but we're not quite there, is
Mhm.
figuring out how we maintain and support the mental and physical health of our nurses. We
Mhm.
don't like to talk a lot about physical health, but nursing is a physical activity, and we need
Mhm.
our nurses to be healthy so that they can take care of their patients. So, thinking about programs that are well resourced when it comes to mental health, well resourced when it comes to physical health, having gyms available, have making sure that nurses have wellness breaks and not just breaks to eat in 15 minutes. I know when I was a nurse, I this is how I eat fast now. 15 minutes was all I had because that was the only opportunity that I had. That's actually not okay. We need to make sure that there's scheduled breaks. We have to make sure we have appropriate staffing. And I think the biggest piece for me that I don't think I realized early in my career is making sure we have education and training around wellness and how we
Mm-hmm.
can create work-life balance. Because sometimes we say, oh, we're going to support you, and there are resources for mental health, and there are resources, there are gyms, and there are things that you need to do to eat better and exercise. But we're not, as nurses, we're not always trained in how to do that. And so having that education and training to be able to support that is important. And being individualized in that approach and customizing that for each nurse is really important, which is where I think the nurse leaders play such an important role in making sure that they're supporting each of their subsequent nurse leaders and nurses in their teams. So I think that really will help us to increase the overall nurse well-being and really promote work-life balance.
Absolutely. And to kind of touch on, that mental health and physical health piece as well, you mentioned the trauma that nurses go through, and that, not only is that seeing people die every day, but it's also experiencing like workplace violence incidents. So, how do you think CNOs can help prevent workplace violence and also support their nurses after things do happen?
Gee, that's a really great question. I have several solutions for that.
Hmm.
Prevention strategies have to start with a zero tolerance policy. There has to be zero tolerance towards workplace violence, and that policy has to be clearly communicated, not just to staff, but also to patients and visitors. And it
Hmm.
needs to be really clear in terms of the procedures for reporting and really addressing those incidents of violence. The other thing I would say as a prevention strategy is comprehensive training. I'm going to be
Hmm.
honest and vulnerable in saying that I don't recall in my early days being trained on how to prevent
Hmm.
somebody from if they were violent to me.
Wow,
I was a
yeah.
NICU nurse. I don't anticipate my NICU babies would be
Hmm.
violent. But
Hmm.
what about parents and visitors? I don't think that I had any drills or simulations around workplace violence. I had drills and simulations around skills. I had drills and simulations around disaster preparedness, but no drills or simulations around workplace violence. So, having that comprehensive training, particularly simulation, is important. The other thing that we don't always think about, but we could potentially think about as we enhance our designs, is really that environmental design in the hospital. We can design
Hmm.
workplaces to minimize that risk of violence, including secure nurse stations and clear escape routes is really, really important. And then as we think about, what are some of the support strategies for our nurses, we really need to think about immediate response. That's extremely important. And everyone on the healthcare team needs to be able to respond quickly if there's a violent incident, including access to medical care and, of course, emotional support. We
Hmm.
have to have that mental health support for our nurses as soon as it happens. And things that we don't think about is peer support, legal support, once that incident happens, because it's incredibly complex when you
Hmm.
have a workplace violence issue in a healthcare system. And so those are some of the things I would say are ways that we can help and strategies that we can support.
Absolutely, yeah. I could not agree more, and I think plenty of the other CNOs who I've spoken to would also agree with you on most, if not all, of that. um, yeah. So to pivot back to one of the other pain points you mentioned earlier, with technological implementation in nursing, what new technologies do you foresee changing the landscape of nursing?
Oh, that's my most fun topic to talk about
Hmm.
because I absolutely love innovation and technology. I think
Hmm.
we're going to see a wave of new technological advances that are really going to transform the landscape of nursing and help enhance nursing care, really improve efficiency, and even maybe support nurse well-being if implemented correctly. One of the
Mhm.
facts that kind of struck me was that we are going to produce now the first generation of nurses who could potentially never touch a patient. And
Mm.
so when I think about these technological advances, I have to say telehealth and telemedicine is going to be huge. Those
Mhm.
remote consultations and nurses being able to assess using that virtual platform will be massive, including
Mhm.
teletriage. How do we do those initial patient assessments and triage via telehealth platforms so that we can reduce those inpatient visits, but also have the competency to be able to do so? That's a skill. We're very much used to having in person assessments and we can see everything. But
Mhm.
telehealth and telemedicine is changing the game, and we have to be able to be competent in being able to do that. Probably the most exciting one is artificial intelligence, of course, and
Mhm.
learning. Thinking about how do we have predictive analytics? So, how do I predict which particular patient is going to be disoriented at night, or could potentially fall, or potentially go into labor sooner
Mhm.
than we thought? And really thinking about clinical decision support as well, being able to have less documentation as a nurse, and potentially having wearables that could take our language and put it into the EHR, significantly decreasing our documentation time and increasing our more time with our patients. So I think those two things are going to be huge as we think about changing that landscape of nursing. The other thing I have to say, and I have to say it because I know some people are afraid of AI, and
Mhm.
rightfully so. It really needs to be implemented with good governance. Is
Mhm.
that there's this notion out there that AI can replace the nurse, but it goes back to what I said. Nursing is an art and a science. Yes, AI may have the science, but AI will never have the art. That's a human touch. And so I think making sure that we integrate nursing with those technologies and we advance together in an appropriate way that is supportive to the patient and also allows the nurse to be her best self or his best self, we are on track. And so I'm excited about the new technologies and how nursing will advance.
Absolutely. I'm glad you mentioned that. I think I actually just did a podcast with another nurse leader about nurse hesitancy towards AI, and she said the exact same thing. It's a tool, not a replacement. And I think that that's important. So, I want to continue on that telemedicine topic. What are your thoughts on virtual nursing, and how do you think that that will impact staffing?
I am excited about virtual nursing. Now, there are various ways that you can define it,
Hmm.
but it is what it is. It's virtual nursing and the ability to be able to kind of augment our nursing services at the bedside or even in the community using a virtual nurse component. I know some systems and some hospitals are using virtual nursing to help with some of the services like discharge that
Hmm.
could potentially be used. I think we have to think about how we can potentially use virtual nursing to take care of some of those normal activities that we do. But I
Hmm.
also would love us to also think about virtual nursing because I do wear that dual hat, which is really exciting in
Hmm.
terms of nursing education and training nurses at the bedside and potentially using virtual nursing as a component or almost like an advocate to the nurse who is a new nurse on the floor. So, not
Hmm.
just using virtual nursing to augment the services or potentially replace some of the services that a current bedside nurse would take, but I think we also have to expand our lens when it comes to virtual nursing and think of virtual nursing as potentially a partner, an advocate in terms of nursing education and training. So,
Hmm.
I love what virtual nursing will potentially do in the future because I think we have great opportunity in that space.
Absolutely. What do you think about virtual nursing as a almost like a recruitment tool, or a way to alleviate kind of that burnout that we were talking about by giving nurses an alternative way to practice?
I love that. And I think it goes back to the questions you asked me about strategies for retention and recruitment, and
Mhm,
also a way to deal with preventing burnout and wellness.
mhm,
That's an example of a strategy for flexible scheduling. Think
mhm,
about the opportunity of a nurse being able to have 6 months in the bedside and then 6 months in virtual nursing. Again, maybe that beeping noise will would go away and they have the ability to recover and then come back on the bedside. I know just because I'm a nurse myself, there may be some of my nursing colleagues that might say, that split might make them lose their skills or they might lose touch with being on the bedside as a nurse. I think that's where simulation comes in. So,
mhm,
virtual nursing is a flexible scheduling option. It is a retention tool. It is a recruitment tool, but it's also a tool to help with well-being as well. So I love that you bring that up because I think that will be something that might be what our nurses are mandating in the
mhm,
future, that they want the flexibility. And the way, we can offset some of our naysayers who say they're going to lose their skills if they're only virtual. Simulation is a way that we can make sure that they continue to be competent while they might be in their virtual nursing stent,
mhm.
so to speak. But I love it. I love all of it, and I can't wait to see where we go in the future.
Absolutely, yeah. So, to pivot back to you personally, what are you most proud of?
Again, cliche, I
Mhm,
am most proud of being a nurse, G. And I'll tell
mhm,
you why. Being in this dual position as a dean and a system CNE, one of the things I did not expect to experience as a dean was the beauty. It took me back every time I have a new class of nursing students coming into nursing, it takes me back to when I was there. And
mhm,
something that I didn't realize because I wasn't on that side of admissions was that we had to defer dreams for others to be able to be there. And so
mhm,
for me, I've recognized that being a nurse is a privilege. I had the opportunity to be in a seat and to be part of this really noble profession. It's impacted every aspect of my life. And
mhm,
I get the ability to be in the privileged position of service every day, which is amazing. I always say the most selfish thing that you can do is to serve somebody else because that feeling is
mhm.
amazing. So it's really selfish to be in that particular position. And so for me, when I think about that question, I'm most proud of being a nurse. I know it's cliche, but it's true. I'm really proud of being a nurse.
Absolutely. I think that's a beautiful thing to be proud of. So I don't think it's cliche at all. But yeah, so my last question for you is, do you have any advice for CNOs or CNEs?
Sure, G. I'm gonna keep it short. I think
Mhm,
anybody who knows me or who've heard me speak in the past have heard me say this. The only advice I have is to be at the table because if
mhm.
you are not at the table, you're on the menu. And
Absolutely.
that's the best advice that I have. Always be at the table for nursing.
Absolutely. And that's a beautiful note to end on. So thank you so much, Dr. Henderson, for your time. I'm really grateful to have had this opportunity to hear your insights and get to know you. And thank you so much to our audience for listening.